Hello, I'm Doug Collins. I'm Congressman from the 9th District of Georgia. And up here in Congress, there's a lot of talk going on these days about Obamacare and the failure that is happening all across our country. It's the failure to adequately care for people. It's adequately caring for those who need health care and having a system that isn't a death spiral. So when we look at it, we're up here as Republicans looking to say, what can we do? How can we help the average American people have access to affordable health care? And today I'm joined by one of our newest members, Roger Marshall from Kansas, who's a doctor who's provided in-depth experience on knowing how it actually affects families and hospitals in his area. So today I just want to take a few moments and talk to Dr. Marshall about the things that are going on. You've been a part of this in Kansas. You've been a part of a hospital. You've helped folks. Tell us why Obamacare is failing. Where do you see that happening?
Doug, Obamacare has been the biggest rue of my life. It's been the nightmare I've lived for the past 5 years, trying to figure out this huge bill that no one understands. It destroyed the relationship between physicians and patients. We no longer have control. I feel like the government is telling us exactly what to do every day with every patient.
How do you see that as affecting, Dr. Marshall, the insurance, which was supposed to be so effective for people, but how do you see that failing individual, folks not only in Kansas but all across the country, those Obamacare insurance failures?
Well, first of all, the average Obamacare policy now has a $12,000 family deductible. That's like having no insurance at all. Who has $12,000 of cash sitting in a bank? Hardworking farmers and ranchers from Kansas cannot afford the Obamacare policy simply because of its high deductible, let alone its screaming high price increases over the past several years.
So really, when you look at it, it's not only providing something that doesn't really help them, but it's also making it cost unaffordable when it was supposed to be an Affordable Care Act, and we're not seeing that. What do you think we need to do? Where do you think we need to go with this? And when we look at this in the healthcare system, what should our healthcare system be looking at when dealing with patients?
First of all, we want to put doctors and patients back in control of their own lives and their own decisions. It seems like Washington can't run anything right. So let's put this back in the hands of the states. And if I could say one thing, Doug, the most important thing I want to do is reassure people who are on the Affordable Care Act now, we're not going to push you off the cliff. It's going to be okay. We're going to have a transition time where we can help you get a new, truly affordable quality insurance product.
One of the things that's often talked about, and we get into this all the time up here, is how it affects individuals. Tell us from your experience, how have you seen that? Because, I mean, it's one thing to talk the policy, but it's another thing to talk about how it's actually affected individuals. What have you seen in your practice?
Doug, unfortunately, probably every week, if not every day, I was seeing more and more patients who were unable to get the care they needed. And for whatever reason, it seems to be the oncology patients are the ones most impacted by this. In rural Kansas, our oncology centers do a great job, but if you have a rare cancer, you need to go to a tertiary care center, perhaps to KU Oncology Treatment Center in Kansas City, or to Houston, or to Mayo. And too often, almost more often than not, the Affordable Care Act policies don't have access to those providers. So consequently, our patients could not get the oncology treatment they needed. It's a horrible situation as a doctor. It's bad enough to tell someone that you have cancer. It's even worse when you tell them, and you can't go to the best place in the country to treat this problem.
And that's hard to tell when you see folks like that. Just as this place is something that when we're looking at dealing with healthcare, it's time to repeal this, isn't it?
It's absolutely time. We can't take it anymore. Doug, we're going to lose more physicians this year than any recent year that I can remember. I was just back in my district last week and talked to an orthopedic surgeon who said he's done. He's retiring. He's had it. This Affordable Care Act has reduced us to data entry people. Nurses are so frustrated. Doctors are frustrated. We want to take care of patients, and all we're doing is entering data into this screen. It's making us worse clinicians. I just can't tell you how frustrated I am personally, as well as all the physicians that I work with.
Well, I think as we work here in healthcare, we see that there's a problem that is affecting our people. It's not only in Kansas and Georgia, it's all across the country. Healthcare is vital to our discussion that we're having here in Congress. The first step is toward repealing, getting rid of this death spiral that Obamacare is, and then beginning to put in common sense solutions that give all patients access to affordable care. We're going to continue that fight up here. Dr. Marshall came to Washington, left his practice to come to the fight. We're looking forward to taking this fight to the American people.